Ladies, do you have pain since you've had COVID? Do you have pain around your menstrual cycle? Well, guess what? There is a new article out. COVID-related distress is associated with increased menstrual pain. Ooh, this is good. So the COVID-19 pandemic resulted in a heightened stress for all women. We know this. Even though there's a large body of evidence that demonstrates stress in general can impact a menstrual cycle, it is not clear if COVID had a specific stress. So what they're implying is, hey, does cortisol and COVID increase your symptoms of menstrual pain? Guess what the answer is going to be. So the key words here is dysmenorrhea, COVID, stress, and menstrual symptoms. There are many women complaining of pain post-COVID, and it is extreme. So here we go. In the introduction, the coronavirus infection disease pandemic dramatically changed the lives of most individuals in the world beginning in February 2020. In an effort to curb the transmission and infection rate of the SARS-CoV-2, most communities did a stay at home. So anxiety about the virus itself, as well as the impact to reduce the incidence of the virus, resulted in psychological stress for many individuals. Women in particular were vulnerable to these stresses, in part due to the role of caregivers and essential workers. The key indicator of women's health is the functioning and cyclical happy cycle of the menstrual cycle. And there's a well-established link between psychological distress and the disruption of the hypopituitary adrenal axis and the hypothalamic axis. So here's the deal. Menstrual pain is one of the most common and disabling menstrual symptoms for women in reproductive ages. We know that there were many studies that came out and actually talked about this, but this study is looking at the perceived stress in women during the COVID times. So they are taking a deep dive and they are saying, for example, adults with fibromyalgia reported higher levels of COVID-related fear and anxiety compared to adults without fibromyalgia, end quote. So what they're saying is, if you already have stress about COVID, if you already have inflammation, they're saying, do you have more pain with your period? So they're saying a large sample here, they're taking these women, they're giving them a questionnaire, they're giving them various screenings. 3,030 individuals completed the initial screening. That does not mean all of them end up staying, but this is substantial and it's enough to make an impact and to actually apply it. So these women were given these surveys. Here we are scrolling through this, and it's a variety of demographics. They were looking at the menstrual symptoms. They were looking at their low back pain, headaches, nausea, diarrhea, pain. And they were making different phenotypes. So how bad is your period and what category do you fit in? The bodily pain. They did a COVID stress scale. Keep this in mind. The COVID stress scale is really important. Then they did a COVID exposure and family impact survey. Also important. Pain catastrophizing scale. Okay, so then they're going to look at all these results and they're going to tell you, guess what? Stress increased your symptoms of menstrual post-COVID because the stress that you endured during the pandemic has caused a severity of your symptoms. Although white Asian women had lesser menstrual symptoms compared to the white community. Interesting. So the CSS traumatic stress scale in the past month were positively related to menstrual changes. The more stressed you are, the more stressed you were during COVID, the greater your symptoms are. What they don't say is cortisol is the master hormone. If you are stressed, you have increased cortisol, which is messing with all your other hormones. The current study aimed to clarify the relationship between COVID and stress, and it seems that they're making it crystal clear. So they found that there was a body pain severity that showed a strong positive relationship with all four menstrual-related outcomes. Okay? Once again, they're saying, interestingly, Asian race had a negative association. But another negative association is that they found that women, participants that were taking hormones, it negatively impacted their symptoms. Hormone interventions are commonly used for menstrual pain, although in this study, we required individuals to still have regular menstrual cycles so they could not be fully suppressing their menstrual cycle. The negative relationship with COVID symptoms was there. Interesting. They do talk about the limitations that they didn't have these women's information prior to COVID, but who did? And so, yeah, they're saying women were exceptionally stressed by COVID and they had more menstrual pain.